One.
Hello and welcome to the Board of Health meeting of December 7th, 2020. Please note that this meeting is being recorded and will be available shortly hereafter for scheduled and on-demand viewing on any smartphone or tablet device. If anyone else is recording the meeting, please notify the chairman. Pursuant to Governor Baker's March 12, 2020 order suspending certain provisions of the Open Meeting Law, General Law, Chapter 30A, Section 18, and the Governor's March 15, 2020 order imposing strict limitations on the number of people that may gather in one place, this meeting of the Chatham Board of Health is being conducted via remote participation. No in-person attendance of members of the public is permitted, but every effort will be made to ensure that the public can adequately access the proceedings as provided for on the order. A reminder that persons who would like to listen to this meeting while in progress may do so by calling the phone number posted on the screen. That number is 1-508-945-4410, and the conference ID is 546-189-493 pound. Thank you. Now I'll turn the meeting over to Chairman John Beckley.
Thank you, Judy. I'd like to first establish our quorum for tonight's meeting. So when I call your name, please indicate whether you're on the call. Dr. Hanson,
On the call.
Ron Broman,
Here.
Ed Sheehan,
Here.
and I'm here. So John Beckley. So we have four members, and we have in listen only Dr. Alan Ward. Tonight, we have one hearing followed by an update and a discussion regarding COVID-19. Let's start with the hearing, which is a variance hearing and approval of IA technology for John Gillis, parcel CG3 on Gillis Road, and representing the applicant is Ryder and Wilcox. Is Andrew Glover on the call?
Yes, this is Andy Grover from Ryder and Wilcox. Can you hear me okay, Mr. Chairman?
Yes, I can. Andy Grover. Sorry about that.
Yes, that's okay.
Why don't you introduce your request?
Sure. So this project, I'm representing Jack and Marilyn Gillis and their property of 0 Gillis Road, which is map 4B parcel CG3. This property contains 26,313 square feet of land, of which 19,049 square feet is upland. This property is not within a Zone 2 area of contribution to a public water supply well. It is bordered to the southeast by an estuary that connects to Mill Creek. And this project, it's a vacant lot, and we're proposing a dwelling and a septic system on this site. The proposed dwelling is centered in the upland portion of the lot, with the proposed septic system situated between the dwelling and the road. The proposed septic system is a nitrogen-reducing septic system, and it complies with all state Title V regulations. I'm before the board to request a variance from the nitrogen loading regulations to allow a third bedroom through the use of a IA nitrogen-reducing septic system. Thank you.
Okay, thank you, Andrew. All board members should have received with their Board of Health packet a memo from Judy Giorgio outlining this presentation or this request, including her recommendations that it be considered as approvable, and it listed on her memo 9 conditions. So with that as an introduction, I'd like to ask any Board of Health members who have any questions or comments regarding this application, please bring them up now. I must say, having been there, this was some spectacular lot.
Yes, it's an incredible lot. It's a very remarkable lot.
It's very high up and safe and has spectacular views, I'll tell you.
Yes, it's been very nice working with the family. It's a family property that's been in their family for a long while, and they finally are moving forward with this project that's been on their list for quite a long time. So it's been nice because they really love and respect the area, and it's been a nice project to be part of.
I assume that the road is named after the family?
It is, yes.
Interesting.
John?
This is Noble. I'm assuming there's no town sewage in this area that's present or coming in the near term.
That's
Not that
correct on my end.
Right.
Yeah, it's Bob. No, this area is not currently planned for sewering within a reasonable time period.
Bob, this is John. Can you describe how the rationale for prioritization of sewering sometimes runs counterintuitive? In other words, when you see locations close to the water, as in this case, you might assume that it would be highest priority, but it clearly isn't.
Yeah, sure. Before I start, John, you may want to make an announcement to people to just ask folks to mute their phone if they're calling in, or to mute their computer, because I'm getting a lot of background noise.
Very good. Thank you.
Okay. Does seem a little counterintuitive. You know, we have a number of criteria that we use in determining which areas, you know, we kind of tackle next. And probably one of the best ways to think about it is a jigsaw puzzle. Obviously, we can't sewer an area unless there's something to connect it to. So in an area like this, there's currently no sewer infrastructure nearby. So, you know, it would be exceedingly costly and time consuming to bring sewer, say, down to this particular neighborhood, because there's no intervening infrastructure in particular neighborhood because there's no intervening infrastructure in which to connect it to. So we'd be looking at extending sewers, you know, all the way down Route 28 and whatnot. And then some of the other criteria we use are how sensitive and how already degraded an embayment water body is. So, you know, early on, we made the decision to concentrate on areas south of Route 28 because that's where some of our most impacted water bodies are. And by that, I mean, you know, the Stage Harbor Complex, Mill Pond, Stage Harbor, Oyster River, Oyster Pond, and then moving areas to the west, you know, areas like Mill Creek and Taylor's Pond and Bucks Creek. But again, you know, it didn't make any sense, say, to jump all the way down to the Mill Creek, Taylor's Pond area because there's no infrastructure there existing. So, you know, we built infrastructure along Route 28 to just short of Meeting House Road, Route 137. And then we've branched off, if you will, into the neighborhood south of there. We basically jump-started some areas on Route 137 because of the Harwich interconnection project. In order for Harwich to sewer their areas in East Harwich area and Pleasant Bay, obviously Chatham had to have the infrastructure on the Chatham side in order to take that wastewater and convey it to the wastewater treatment plant. So like I say, there's a whole series of criteria that we use in determining which areas get sewered. I won't say first, but in what particular order. And it's really driven by having the intervening wastewater infrastructure available to connect an area to. That's one of the most critical components.
Thank you. That was very informative. Questions back to this application? Do any board members okay with this? It seems pretty straightforward in my mind.
Yeah, there's Noble. I note that the 3-bedroom IA system has less nitrogen loading per year than the conventional two-bedroom septic. So it seems pretty clear cut to me.
Can I get a motion to approve from a board member?
Ed Sheehan, approve.
Okay, we have a motion from Ed to approve. Do we have a second?
Second, Noble.
Okay. Any further discussion or comments? Anybody from the public wish to comment on this before the Board of Health moves ahead? All right.
This is Noble. Does Judy have to read all the conditions, or?
I think we should have that become part of the motion. Ed, would you amend your motion to include the 9 referenced conditions on Judy's memo of November 30th?
Yes.
Judy, can you read them?
Yes. The applicant should restrict the property to a maximum of 3 bedrooms and record this restriction on the deed at the Barnstable County Registry of Deeds. The applicant shall submit a copy of the executed deed restriction and release of, and deed restriction to the board. Throughout the life of the system shall be under an operation and maintenance agreement. The O&M agreement shall be for at least 1 year and may be with any mass certified operator of the appropriate grade that has received training in the company on the operation of the system. Effluent of the system shall be monitored at least twice per year for the first 2 years, preferably in May and October. The effluent shall be field tested as follows. Visual examination of the effluent of color, turbidity, and effluent solids. Effluent pH to determine if the wastewater is between 6 and 9. Dissolved oxygen, 2 milligrams per liter or more. Turbidity less than or equal to 40 NTUs. In addition, a laboratory test of the effluent for total nitrogen to meet the performance standard of 19 milligrams per liter shall be collected and analyzed by a certified lab. Water meter readings are to be provided with the semi-annual report. If any of the field tests or lab tests fail, follow-up tests shall be conducted by a certified lab and an evaluation made by the operator within 30 days. After the required 2 years testing, application can be made to the board or their agent for review and possible modification of the monitoring requirements. The applicant shall sign a covenant with the board agreeing to comply at such time as the town of Chatham, through its Board of Health and Board of Water Sewer Commissioners, directs the connection of this property with whatever wastewater management option is specified for this watershed, the sewer, that is. And this covenant shall be recorded at the Barnstable County Registry of Deeds. The applicant shall agree to apply a minimum of 6 inches of compacted topsoil to all landscaped areas. The engineer shall submit an engineered as-built plan, including as-built elevations with a written certification that the system has been installed in accordance with the approved plan. No alteration of the floor plan of the dwelling or the engineer site plan will be allowed without further review by the Board of Health or its agent. And this variance is granted pursuant to the State Environmental Code Title V and the Town of Chatham Subsurface Sewage Disposal Regulations, and is valid for 1 year from the date of the Board of Health approval. A permit must be issued and work commenced during that 1 year period, or the variance shall expire.
Thank you, Judy. With that having been reviewed, I'd like to call the question now. When I call your name, please indicate how you vote on the motion. Dr. Noble Hanson.
Approve.
Ron Broman.
Approve.
Ed Sheehan.
Approve.
And I vote to approve. So we have the motion 4-0. Motion is approved. Let's look.
Thank you very much, everyone. Thank you.
Thank you, Andrew. You're welcome. Let's go to item number 2, which is our regular update and discussion regarding COVID-19 with Dr. Robert Duncanson, Director of Health and Natural Resources. Dr. Duncanson.
Yeah, good afternoon, everyone. So it's been a fairly busy week or so, especially in the last couple of days. So I'll do a quick run through of the numbers and then a couple of updates for the board and the public's education, if you will. So right now, on a worldwide basis, we are currently at 67.4 million cases of COVID-19, and we are over 1.5 million deaths. In the United States, as of earlier this afternoon, we were currently at 14,883,000 cases and 282,000 deaths. The next nearest country to the US in terms of the number of cases is India, which is currently at about 9.6 million cases. And in terms of the number of deaths, the second country compared to the US is Brazil at 176,000 cases. So the US continues to lead the world in both number of cases by almost a little over 5 million, and in the number of deaths by about 100,000. So unfortunately, the US continues its dubious distinction of being number one. There was a period of time when other countries were catching up to the US, and those differences were narrowing quite substantially, but over the last 3 to 4 weeks, the number of cases in the US has gone up substantially, and we're rapidly catching or leaping ahead of the second highest countries in both number of cases and deaths. In Massachusetts, as of yesterday afternoon, because today's update is not out yet, and remember, those updates are now coming out at 5 o'clock in the afternoon instead of 4. But as of yesterday afternoon, Massachusetts had 256,844 cases and a little over 11,000 deaths at 11,004. In Barnstable County, as of yesterday afternoon, we were at 3,477 cases. And since your last meeting on November 16th, the cases in Barnstable County have gone up by 1,172. In terms of the number of deaths, we are currently at 197 for Barnstable County, and that is an increase in 9 since your meeting back on November 16th. In Chatham, we currently have a cumulative total of 55 cases, and that goes all the way back to January 1st. And we are currently at 3 deaths because there was a death of a Chatham resident over the weekend who had tested positive for COVID-19. Whether or not that death was absolutely attributable to COVID-19, I can't tell you at this point, but I think it was fairly compelling that the individual was tested positive last week for COVID-19, and then unfortunately a few days later I noticed the obituary in the paper. So right now we basically have 3 deaths of known Chatham residents that are at least connected to COVID-19. And that's the first increase in deaths for a Chatham resident that we're aware of since the May-June timeframe. As I'm sure everyone is aware from reading the newspaper or watching the nightly news, we are in a surge both nationally and regionally and on Cape Cod. And we're starting to see, a surge on top of a surge, if you will, due to the Thanksgiving holiday. So last week, at the end of last week, we were notified of an employee who worked at both the Squire and Bluefin Sushi testing positive, and so both of those establishments closed down for the requisite period of time under your order that you passed about a month ago, requiring a mandatory 24-hour closure, and also the public posting of the positive case at the restaurant for a minimum of 96 hours. The Squire was actually going to be closing through December 22nd, so they actually made the decision to close for a longer period of time. And then on Saturday, we were notified of a positive employee at CBI, a food service worker. And then today we were notified of a second employee testing positive at CBI. Whether those two are connected is unknown at this point, given the time frame of when the first individual last worked at CBI. And when the current positive employee worked, they may not be connected, but we're not actually absolutely certain at this point whether they are or not. But CBI did close down the main dining room and restaurant over the weekend. After I talked to them when they called me on Saturday, they did move food service operations over to the Beach House Grill because that grill had not been open because of the time of year. And so they were able to move temporarily over to the other kitchen area and utilize that to provide food service. And then I know they were being closed Monday and Tuesday today, and I think Wednesday as well, which is pretty common for them this time of the year. They pretty well shut down, on days when things are not very busy. And then also over the weekend, we were notified of 2 employees at Liberty Commons also testing positive. They have done their contact tracing and identified any residents and other employees. Other employees obviously are quarantining, and residents and other staff members are being tested as part of their protocol. In addition, Liberty Commons has ramped up their testing above and beyond what they are required to do by the state to make determination as to whether or not, because obviously, as you all know, assisted living facilities and long-term care facilities were the epicenter for COVID cases and deaths in the springtime. And Liberty Commons just wants to get a very quick handle on whether or not they have to go any further in terms of that. So additional testing is underway at Liberty Commons.
Bob,
Yeah, so with that, I'll stop and answer any questions related to that, and then I can give you an update on some of the other things that have happened.
Bob, the 2 cases at Liberty Commons, were they workers or residents?
No, they were employees.
Okay.
So those employees are not at work. They're obviously out for the 10-day period. They did identify a number of other employees that may have had close contact. And so those employees are self-quarantining in accordance with the guidelines. So if there's no other questions relating to that, I'll just go over a couple of other things. The governor did have an update today at 1 o'clock and made some announcements. And then commensurate with that, the state did send out some additional, or I shouldn't say additional, but some updated guidance. One of the things the governor touched on was the fact that hospitalizations have increased 44% recently as part of this surge that we're experiencing. And quite honestly, we're not even seeing the full surge from Thanksgiving yet because we're not quite at that 2-week period. But cases have gone up dramatically since Thanksgiving, when prior to that and some of the limitations that the governor and the state had put in place, cases were actually dropping a little bit. Ever since Thanksgiving, they've gone up fairly dramatically. So the state is putting in place some additional requirements taking effect later this week. So effective on Friday, hospitals will need to cease elective procedures and any inpatient treatments that would impact inpatient capacity, because a lot of the hospitals, because of the number of cases, are seeing, they're starting to see limitations in ICU beds. They're starting to see limitations in regular beds. So the state is being proactive in terms of having the hospital cease elective procedures. This does not impact ambulatory or outpatient services. So preventive care appointments and things such as mammograms, colonoscopies, children's pediatric checkups and all are not impacted by the limitations on inpatient or elective procedures that would be done in the hospital. So the state wants those preventative care things and cancer screenings and all to continue. Also, the governor announced today that a testing site was going to be opening in Falmouth. That announcement was a little premature. That is a testing site that a number of the towns in the county and others have been working on. That site will probably not be up until later this week, or even potentially early next week. And it's not a site that is part of the state's Stop the Spread grouping, if you will. But the Cape Legislative Delegation was able to secure funding for a testing site in Falmouth, which would be open to anybody on the Cape, but because of the funding source, it has to be located in Falmouth. So hopefully that site is up and running next week, and that will take anybody. You will not need a doctor's order. You do not have to be symptomatic. It's going to be open to asymptomatic individuals. However, you will need an appointment. It won't be a free-for-all. An appointment will be necessary. And then hopefully later this week, there's going to be another site opening up in Hyannis, using, again, additional funding from both the state as well as Cape Cod Healthcare. And again, that will also need an appointment. But it will also be open to asymptomatic individuals. So hopefully, I shouldn't say hopefully, we're finally making a dent in this kind of testing desert that Cape Cod has been now for months. I think I've reported before that, very strong efforts were made to try to get one of the states Stop the Spread free testing sites here on the Cape without success. But hopefully these other alternatives will fill that void. And hopefully soon we will also be talking about some testing on the Outer Cape. There's efforts underway to bring testing to that area from Provincetown, say Truro, and out to Harwich, if you will. And hopefully more details will be coming on that shortly. And then I just wanted to touch on the state issued new guidance for quarantining as of today. Which follows along with some updated guidance they issued last week. But if you remember, prior to just recently, if you were identified as a close contact to someone who had tested positive for COVID-19, it was a 14-day mandatory quarantine period. CDC has updated their guidance as well as the science about COVID-19. And so both the state and CDC are updating their guidance on quarantine to now provide the ability to shorten that quarantine period. And the latest guidance that came out from the state today is that somebody identified as a close contact can discontinue their quarantine on day 8 if they meet the following. They've had a PCR or antigen test on day 5 or later, and the test result is negative. They have not had any symptoms, and they will continue to conduct active monitoring for symptoms through day 14. So if you meet those 3 criteria, you have to have a mandatory 7-day quarantine period, but you can discontinue that on day 8. Under those conditions, there will still be about a 5% risk of coming down with symptoms, during the remaining 6 days or so through the 14-day period. You can also, if you choose not to get tested, you can also discontinue quarantine on day 11 if you have not had any symptoms up to that point. You continue to do active monitoring through day 14. And that scenario carries about a 1% risk of coming down with symptoms through day 14. And then obviously, if you choose, or if you've had any symptoms whatsoever, even if you did have a negative COVID-19 test, you have to remain in the 14-day mandatory quarantine period. So that information just came out. That update just came out this afternoon, and I'll send that out as soon as we finish the call here. In addition, the state did issue some additional updated guidance for return to work, which basically mirrors that quarantine guidance. It does provide some clarity, some additional clarity on individuals who are critical infrastructure workers, that even though they've been potentially identified as a close contact, they can continue to work under certain circumstances if they've been identified as a critical infrastructure worker. And those are folks like people in the healthcare industry, water and wastewater operators, that need to stay on the job to maintain some critical public services. While they may have been exposed to someone, they cannot have any symptoms and they cannot have tested positive, and they have to wear a mask at all times and some other things in order to maintain, continuing to work. However, it only really applies when they're on the job. When they're home, they should continue to abide by the quarantine guidelines. So it's really a very narrow period that allows them to continue working, but it doesn't basically give them a get out of jail free card for the entire quarantine period. When they're home or not on the job, they should be following the quarantine requirements. But it does allow those folks to work, provided they abide by the other guidelines such as mask wearing and whatnot. Let me just check my notes, see if there was any other highlights that I wanted to bring to the board's attention. No, I think that pretty well covers everything I wanted to update the board on today. So be happy to answer any questions.
Bob, this is John. I've got one question. If a patient has symptoms and gets to the day 14 and they still have symptoms, how many days do they have to be free of symptoms before they can come out of isolation?
It's generally called for they have to be free of symptoms for 24 hours. And things like fever, their fever has to be reducing without the use of fever reducing, medications like aspirin or Tylenol or something like that. Mm-hmm. So generally it's a 24-hour period.
Okay, thank you.
Bob, Ron Broman.
Yeah.
Are they planning anything for any vaccine sites on Cape when they finally are sent out? Are there going to be locations, or how they are looking into that at all?
Yeah, there's a lot of activity on the vaccine front, and in fact, there's going to be a conference call on Wednesday specifically on the vaccine issue. Right now, we know that Massachusetts is going to be expecting about 600,000 doses of vaccine. About 300,000 doses of vaccine by the end of December. They are going to be targeting healthcare workers and folks in long-term care facilities initially. There are efforts underway to expand that to first responders and, other critical folks in that arena. But we haven't seen the state's vaccine plan was due to CDC on Friday. We haven't seen that plan yet. It hasn't been released publicly, and I'm aware of. I checked the website about 2 hours ago, and they still only had the draft from October up. So we haven't seen if there's been any substantial changes, although from what we're hearing, there hasn't been. At this point, you know, the word is that the initial vaccine, at least, is going to be distributed to acute care hospitals in the Commonwealth. And then CVS and Walgreens are teaming up with the long-term care facilities to meet their immediate needs. So we haven't seen anything yet on specific locations for like drive-through clinics or anything like that. I think we may get more information out on Wednesday. You know, we've been talking with the folks at the county, meaning Chatham and other towns. You know, all the towns in the Cape Cod have emergency dispensing site plans. And generally we exercise those plans every year with our flu vaccine clinics. But specifically how the COVID-19 vaccine may be distributed to the larger general population, we just don't know yet. And keep in mind that probably will not happen till sometime in the spring, early spring at the earliest, because the vaccine is really going to be doled out in dribs and drabs, if you will, and at this point is going to be, you know, prioritized to the higher risk populations and whatnot. But hopefully, you know, I expect we may have more information that, you know, come the conference call on Wednesday.
Thank you.
Bob, this is Noble. Yeah, I had a question about how accounting for COVID cases in the hospital, because I think we follow that number pretty closely. I'm assuming, and correct me if I'm wrong, that every patient that gets admitted to the hospital is tested for COVID. And so that there are some patients who were admitted for something else and are asymptomatic in terms of COVID, but their test comes positive because of the admission, and then that gets counted as a COVID case at the hospital.
Yes, that's my understanding as well. Yep.
Thanks.
Well, thank you very much, Bob. Any other questions or comments for Dr. Duncanson?
Yeah, I had one real quick one. This is Noble again. State counts probable and confirmed cases. Do we know how many of the probable cases, what the false positive rate is among those probable cases? I guess that's the antigen test.
The state really only reports confirmed cases.
Okay.
We generally lump them together and include both probable cases, but I don't have any information on, you know, we do know the antigen test is getting better. And in fact, the state is going to distribute about 150,000 of the Abex Binax Now kits to community health centers and hospitals for use over the holiday season, just to try and increase the testing rate even more. That's the same test that was earlier distributed to the schools for use in the school system. So now the state is making it more widespread throughout the Commonwealth. But I don't have any numbers for you right now, Noble.
Yeah. Is there any ballpark figure about the false positive rate for the antigen test? Just general, just ballpark?
The Binax Now one, which is the one they're using in the schools and the one the state's releasing, the state did do a comparative test with the PCR. And I don't have the specific number, but it did track pretty well. And that's why the state's kind of using that center more broadly. But I can get you the copy of the state's report that was sent out and email that to the board.
Okay, thanks.
Any other questions for Dr. Duncanson? I've got one question to ask Judy. It relates to a copy of a letter you had sent to Barbara Henderson on 631 Main Street in Chatham about non-compliance with the wearing of masks. Can you tell me two things. Number one, what store is that? And
That's the Ben Franklin store. We've had repeated complaints about that. So we went ahead and sent that letter. And as of today, I just heard from someone just unofficially that they're still, the person running the place, the owner, is still not wearing his mask. So the next step will be to perhaps have some type of a hearing or start issuing tickets. I guess I got to look at that a little closer. But yeah, that's the Ben Franklin. It's been an issue all summer. I've gone in there, I've given him warnings, verbal warnings, now a written warning. So doesn't seem like he cares.
Judy, this is John. I would say, at least my opinion is I would go ahead and start the fines. I don't know what the other board members think, but
I could do that.
Ron Brummel, I think it's a great idea to start enforcing it, Judy.
I mean, this is about the health of the public here. This isn't just him.
Mrs. Noble, has he been given some kind of a written notice about the lack of mask wearing?
Yes, I sent an order letter.
Okay.
So I can share that letter. If I didn't share it with all of you, I apologize. I'll share that letter.
I agree it might be time to move ahead because I remember earlier in the summer, the same situation was there.
So this non-compliance is not for lack of awareness and understanding. It's just somebody refusing to comply. I think.
Yeah, no, he's been very adamant that he won't wear one. All his employees wear them, from what I understand.
Mm-hmm.
Everyone else in the store wears them.
Mm-hmm.
He's not supplied any information to us that he can't wear one. And I don't think it would matter if he did, but yeah, it's been an issue.
Well, are the other Board of Health members okay with Judy taking an urging from us to proceed if she can or whenever she can with the fines?
This is Noble, I agree.
Ed Sheehan, I agree.
Okay.
Okay.
And on another issue, since we're talking about fines, I have a court date next week. It's a Zoom hearing on Body Strong because they have not paid their fines. So I will be attending that with our town representative for town council next week, I think Tuesday, the 15th. So we'll see how that plays out.
Very good. Thank you, Judy. We do have to pass. Is there another question from a board member?
Yeah, this is Noble, just a violation update topic. The property on Mill Hill Road, any update on that situation?
He received his letter. I haven't been down there to take a look, but I seriously doubt he's done anything. I don't know, Bob, have you heard anything about it?
No, I have not. I do know he received the letter that was sent by Judy. He received the letter that was sent by the fire department. But I haven't heard that it's resulting in any change. So I think, probably at the end of this week, we at the staff level and the town manager and town council will have a further conference about, what next steps may be. Keep in mind in the Board of Health letter, at least, I think he was given 21 days. He had 7 days to start and then 21 days to complete things, or 30. So, we're right in that time frame at this point.
Yeah, I'll review that letter and then I'll take a ride by and see if there's any noticeable changes.
Good. All right, any other questions or comments from Board of Health members to staff? I'd like to move on and approve the minutes for November 16th, 2020. Can I get a motion to approve the minutes?
Motion to approve.
Can I get a second?
Ed Sheehan.
Noble, second.
Okay,
Did you open it to the public for the last topic?
I can ask if anybody from the public wishes to comment on any of the
Oh, yeah, I guess it's, yeah.
any of the discussions. I certainly will receive any public comments right now if somebody would like to weigh in. Otherwise, let's proceed with the acceptance of the minutes for November 16th. When I call your name, please indicate how you vote on the minutes. Dr. Hanson,
Accept.
Ron Broman,
Approve?
Ed Sheehan,
Yes.
and I vote to approve too. So the meeting minutes for November 16th have been approved. Any remaining issues any Board of Health member would like to raise before we adjourn? Hearing none, can I get a motion to adjourn?
Motion to adjourn, Ed Sheehan.
Ed, can I get a second? Can I get a second on the motion to adjourn?
Second,
Ron?
Ron Gorman.
Thank you, Ron. Okay, when I call your name, please indicate how you vote on the motion to adjourn. Dr. Hanson,
Adjourn. Yes.
Ron Broman,
Yes.
Ed Sheehan,
Yes.
and I vote yes as well. So thank you, everyone, for participating on the meeting tonight. Thank you for staff, as always, and have a good night, everyone. Bye-bye.
Thank you.